Hi, I'm Dr. Dhanwanti Rajwade, and you are watching Anatomy of Bias. Dr. Modi, you told me that several years ago, a patient had come to you with a case of male infertility, and subsequently you realized it was an unconsummated marriage. Can you narrate to us how that patient came to you and what he presented with?
Many years ago, this 30 odd year old man who's recently married came to me with little bit of a difficulty in passing urine. He felt that his stream wasn't the best of streams. He had to strain a bit. There was a little blood in his urine. So we sort of investigated and found out that there was a narrowing in his water pipe. This is called as a urethral stricture, which sometimes happens in men who have multiple sexual exposures. So I actually asked him prior to the procedure whether he was, sexually active and whether there was any high risk behavior. And he said that he was a virgin and he had never had any sort of exposure at all. Then maybe about a year and a half or 2 years later, frantically calls me in the middle of the night at about 11 or 12. And he's like, Doc, I need to chat with you. I need an urgent appointment. So I said, okay, sure, come in tomorrow. So when he came in, he sort of came in with his wife and they sat across and they discussed that there was, it was really difficult for him to get an erection, especially at the time of sexual intercourse. So we basically went through his entire, the detailed history. His morning erections were good. When he was masturbating, his erections were good. So it was just when it came to the act of intimacy, of sexual intercourse, he just could not perform. So I discussed this entire problem with him and his wife, and they hadn't even consummated their marriage. They were a little worried. It had been a year and a half or 2 years since they actually had, since the time they were married. uh, Gave them a little bit of a pep talk, gave them some tablets to improve his performance. And I told him to come back and see me in a couple of weeks or a month's time to see if the medicines would have helped him and my pep talk sort of would have changed the way he uh, approached his sexual health. Then what I hear from him about 3 months later, saying that uh, things didn't work out, and his wife sort of wanted to have kids because she was also catching up with age. They had visited a gynecologist who had suggested they go in for infertility treatment. So I said, fine. I mean, unless you consummate your marriage, you're not going to have kids naturally. So then the only other option, if you all are so desperate, is to think about artificial reproductive techniques. When this happened, I told him he'll need a semen analysis, sort of document what sort of testicular function he has in terms of what sort of sperm count he has, and then we'll take it from there. But at the same time, I told him that he should think about his sexual health also at the same time. To which he's like, "Yes, doc, I'm gonna do it. I'm gonna take these pills. It's gonna work out." It's quite an optimistic chap.
Is it normal, Dr. Malav, for a person to wait 1.5 to 2 years to be able to confide in his urologist? Is there that level of societal bias with a problem like this?
Yes, in fact, I mean, so unconsummated marriage is a fairly common problem in our society. Uh, it's it could be 1 year, it could be 6 months, it could be sometimes even 3 or 4 years. I mean, I would say I see one couple a month.
So, the psychiatric or the psychological element, I would say, could be a lot of societal bias on the basis of the man or the woman, or then there could be an actual physical problem that could be affecting a
Correct,
performance of either party.
correct. Causes for unconsummated marriages are like either it could be the problem with the man, where there's a problem with his foreskin, it's too tight, he's having pain when there's intercourse, or there's some element of erectile dysfunction, which most often is psychological. or there's some sort of sexual myths or difficult different perceptions, some aversions, asexuality, or whether it's a problem with the wife, which is fairly common in terms of vaginismus, where she feels there's pain when someone penetrates, so she sort of tightens the vaginal muscles. So the patient may even go to a gynecologist. The, the female partner may go
Okay.
to a gynecologist seeking treatment for infertility, saying that, okay, we're not having kids. And then throughout this history process, we try and pick out things that which could possibly be uh, the problem. And then you sort of try and address it as soon as possible, because this is like a sort of semi emergent situation where you want to help them first
Yeah.
have sex and then eventually try and get
Conceive and have a
pregnant.
child.
Yes.